Correct posture and body mechanics are essential for a physical therapist. Lifting, lowering, pushing or pulling a patient or object increases stress and strain on the therapist's musculoskeletal system. Any activity in which a therapist must lift, lower, push, pull, or carry a person or object should follow the 5 cardinal rules of correct body mechanics. 1. Keep the load close. The center of mass of the object being moved should be kept as close as possible to your body. 2. Create an appropriate base of support. Your base of support when moving a patient should be as wide, from side to side, and as long, from front to back, as necessary to maintain balance throughout the maneuver. When it becomes necessary to change the base of support, you should avoid placing your body in awkward positions. When movement of your feet is required, then move so that you avoid crossing your legs or feet. Using these strategies will lessen the potential for tripping or falling. 3. Use isometric contractions of the trunk extensor and abdominal muscles to keep the trunk in a steady position during the activity. Prior to moving the patient, move into position, set your position, and then look forward. Although isometric contractions of the trunk extensor and abdominal muscles are used, you should avoid performing a Valsalva maneuver. A Valsalva maneuver closes the windpipe during heavy exertion. This will result in increased internal pressure, which can cause rapid and dramatic increase in blood pressure. 4. Lift with your legs. Utilizing the large, strong muscles of the legs when lifting or lowering a patient or object will help prevent flexion or extension of the trunk. Lifting a person or object from the floor should start from a squatting position. The depth of the squat should be sufficient to reach the person or object being lifted. 5. Don't twist your body. When you need to change direction, this should be achieved by moving the feet, not the trunk. Use the same rules of body mechanics, posture, and alignment, whether lifting or lowering a person or object. Transferring a patient requires movements which have the potential of causing loss of balance as the combined center of mass moves away from the center of the base of support. Moving your feet slightly further apart will increase the base of support. Before transferring a patient, check the arrangement of patient and chair, bed, or treatment table. Keep the distance to be moved to a minimum and ensure that the area is free of unnecessary equipment that might interfere with the transfer. To lift or lower a patient or object, place the feet in stride and slightly apart. This stance increases the base of support in both lateral and front-to-back directions. Centering the load within the base of support and keeping it close will aid stability and maintaining a balanced position. Using the isometric contractions discussed in Rule Number 3, maintain vertical alignment so as to reduce the potential for injury. Keeping the person or object being lifted as close to your body as possible maintains the combined center of mass within the base of support and makes balance and correct postural alignment easier to maintain. When moving large pieces of equipment, such as a plinth or gurney, or when guarding a patient during ambulation, you should be positioned behind the equipment or patient facing the direction of movement. This will provide the patient with an unobstructed view and path of movement. You can then determine a path that is free from obstruction. When guarding a patient during ambulation, you should be positioned with your feet in stride and with your body at a 45-degree angle slightly to the side and behind the patient. Note that the therapist is holding the patient by the gait belt and shoulder. If the patient should start to fall, this position will allow you to pull the patient's center of mass toward you, and the combined center of mass can be maintained within the base of support with a relatively small shift of your weight. This doesn't usually require large foot movements. The base of support must initially be large enough to support such shifts should a patient start to fall. In order to achieve easy movement, your feet should not be crossed during ambulation, nor become entangled with the patient's feet or ambulatory equipment. Whenever you are lifting or moving a patient, plan ahead. Careful planning of your movements and preparation of the area to be used, plus the use of proper body mechanics and safety precautions will provide your patient with safe and effective care. If at any time you doubt your ability to lift or move a patient or object safely, always obtain appropriate assistance.